I'm the executive director of Independence.
Sorry, I was trying to do that where I wouldn't
Sorry, let's get the legal work out of the way. I'm Sarah Baysart, the executive director at Independence Now. We're the Center for Independent Living that serves Montgomery and Prince George's counties. And today I'm going to quickly hand things over to Abiola Heliger, who is our Montgomery County Independent Living Specialist, who's invited all these good speakers today. But just to remind folks that this is the Independence Amplified Maryland show that we have just about every Monday from 2 to 3 p.m.-ish. And we welcome you and invite you to always try to remind folks that you are welcome to give donations to the IAM sessions, that we are still taking those. Here we are a year and a half later, never thought we'd be continuing to host these shows this far into 2021, because we started when the pandemic was getting underway at the beginning. And it's been a lot of fun. We've learned a lot of things and had a lot of great speakers. We've also given many Netflix recommendations, and apparently we've moved on to radio station recommendations today. So that's a good thing. Always fun to catch up with each other. But we have sessions coming up next week is a session on the Paralympics. If Joe Awkward signs in a little bit later, we'll just have him say something about that at the end of the show. And then the following week, Katie Collins-Urke is hosting the Disabled Parents, wait, I'm getting it wrong.
Disabled Parenting Project.
Disabled Parenting Project, thank you. And a panel of parents who are people with disabilities as well. So that's 2 weeks away. It gives you a little heads up to what's coming up later in August. And I'm just gonna let Abiola take things over. We ask you to use the chat if that works for you to ask questions, otherwise to try to hit the hand raise or work yourself in easily verbally when Abiola takes questions, which I believe will be at the end of the presentation. So thank you all for being here. Abiola.
Thank you, Sarah. Thank you so very much. I am so excited about today's presentation because I had the opportunity to be able to attend the workshop or training that the Maryland Center of Excellence on Problem Gambling provided. I think it was a month or maybe a month and a half ago. And it really opened my eyes to the importance of just some of the work that social workers are doing when they're doing an intake, and highlighting that some of the persons that we serve, individuals with disabilities, when we first meet with our consumers, they may talk about we usually ask them what their primary disability is, and we may hear about what they consider their primary disability. But there may be some other things that have an impact on the individual that we never ask about, that we never even think about. And that was what that was why the presentation on the centers on problem gambling, why that was so interesting to me, because one of the issues that may very well impact a person with disability who's coming to one of our stills receiving services may in fact be some form of addiction, including problem gambling. And so that's why I thought it might be useful to hear from them. We've got Mary Drexler, who is a Master of Social Work, who served as the Program Director of the Maryland Center of Excellence on Problem Gambling since 2017. And this is at the University of Maryland School of Medicine. She has her Master of Social Work is from the University of Connecticut, and she has been working in social services for 38 years, and certainly has got a broad range of experience in and oversight now in the center's initiatives on problem gambling, prevention, awareness, treatment, peer support, and public policy. And before that, Ms. Drexler held a position of responsible gambling program director for 3 years for the Maryland Lottery and Gaming Control Agency. And then in addition to all of that, she's also worked in crisis intervention, suicide prevention through her work with 211 Connecticut and Contact USA. I thought that was really important to make sure that I mentioned because 211 is something that we're becoming more familiar with and referring consumers to when they've had, when they are facing mental health crises. And I just think that that's so important. We also have Kristen Beal with us. Kristen is the clinical manager for the Maryland Center of Excellence on Problem Gambling, the center, also at the University of Maryland School of Medicine. And in her role as clinical manager with over 18 years of experience in behavioral health counseling, Kristen provides consultation and technical assistance to organizations and private practitioners integrating problem gambling counseling into their practices. In addition, Kristen works closely with the center's peer recovery specialists and helpline staff, connecting help seekers to the resources they need, as well as being an integral part of the center's outreach efforts. She began her career with the University of Maryland's methadone treatment program, acting as lead counselor and as a patient advocate to increase awareness and reduce stigma of methadone treatment. She has also worked at the Baltimore Crisis Response as a mental health counselor, working alongside a nurse. She performed crisis interventions and assessments in the community. Kristen is also has a master's degree in social work from the University of Maryland, Baltimore School of Social Work, and maintains her license. She's a licensed social worker with the Board of Social Work Examiners, as well as CACAD. Kristen, you can explain what that is with the Board of Professional Counselors and Therapists. I did not realize that Mr. William Hinman was going to be joining us as well, but if I'm not mistaken, he's the director of the center. And Mr. Hinman, perhaps you could introduce yourself and tell us a little bit more before we leap into today's presentation, which is going to explore disordered gambling in its association with decreased physical and mental health functioning, provide insight into the links between family history of gambling disorder and psychiatric comorbidities and existing links between drug abuse, dependence, tobacco smoking, and at-risk gambling, and also identify the risks and factors and warning signs of problem gambling and the resources available. With that, Mr. Hinman, if you wouldn't mind introducing yourself. I apologize, I didn't have the bio with me.
Oh, no problem. My name is Will Hammond. So good to see everybody on here. Thank you so much for having us. I'm actually the certified peer recovery sports specialist for the Center of Excellence on Problem Gambling. And what I do is I assist individuals seeking to limit, control, or stop their gambling altogether. I'm actually in recovery for disordered gambling, so I can attest to how bad it can get. I was actually suicidal at the end of my gambling run. I cover Southern Maryland, which is Anne Arundel, Prince George's, Montgomery, Charles, Calvert, and St. Mary's County. So when an individual calls that 1-800-GAMBLER helpline number, they get their zip code and they connect them with me if they're in my territory. I also get a lot of referrals from providers that are treating someone that needs additional support. I do a lot of problem gambling presentations, awareness activities, and things of that nature. So just out trying to spread awareness as well. And I really appreciate you having us.
Thank you so much. I believe that our guest speakers have a presentation, and I think we have to allow, is it Mary that you have a presentation?
Kristen's going to do the slides. I'm going to start off the presentation, but she's going to run the slides. So Kristen has started sharing. There she goes. Okay. She's so good. This is why I have Kristen and Will on my team, because they know what they're doing. So, okay, I'm just going to start by thanking you all for allowing myself and Kristen and actually having Will just join so that if there are any questions, he can answer. You know, you just mentioned Kristen is our clinical manager, and today we really want to present on disabilities and the link to problem gambling and some of the resources that are out there, but we really appreciate you giving us this opportunity. A brief, number one, the center's been in place since 2010. So we just celebrated our 8th annual conference. So we're real excited. We're happy that you enjoyed, I believe you were talking about our annual conference, which was the end of June, but we really enjoyed, I'm glad you enjoyed the information we had to disseminate. So today's objectives really are just a brief overview of who we are. And you did such a good job, Aviola, on saying what we do. I'm going to go really quickly through that slide. You're going to learn the risk factors and warning signs with problem and/or disordered gambling. It used to be called pathological gambling. Since it went into the DSM-5, it's referred to as disordered gambling. Means the same thing, pathological or disordered gambling. And we're going to learn the correlation between gambling and the spectrum of disabilities, intellectual, developmental disabilities, mental health disorders, and even physical disabilities, and learn the resources available for those struggling with gambling. But I'll tell you right up front, more research needs to be done. Even when I was looking into what we should discuss today, more research needs to be done on the disability side as well as the problem gambling side, because most of the research I could find was from all other parts of the country, not the US, which, you know, says something about the more work we have to do. So what do we do at the center? Just briefly, we promote healthy and informed choices regarding gambling and problem gambling. And we do that by working with key stakeholders. We work very closely with NCADD here in Maryland, with NAMI Maryland, with other organizations as well. Within the university, we're part of the Department of Psychiatry and Medicine. Epidemiology does some research for us. We'll talk a little bit about the prevalence studies they've done to ask Maryland residents where they are with problem gambling and disordered gambling. We work with social workers. We work, you know, to understand the law. We do a lot with legislation and monitoring legislation, because as you know, Maryland keeps increasing gambling venues and legalizing gambling. So it's not going away and we need to address it. So as you mentioned, and I'll do this briefly, we do several things, and everything we do is provided at no cost. And I think that's important to understand. And we'll also talk about the no cost treatment list that we have. But public awareness, we do it through campaigns, through social media, TV, radio. We do community outreach. We want to be in the communities across the state in every region. Will is our peer for the southern part of the state, but we have 4 other peers that cover the rest of the state. So we want to be involved if you have an activity or anything that we can be involved in to get information out, not just to providers, but to the general public and to Maryland residents. We do treatment technical assistant. We maintain a list, what we call our provider network list. There's probably around 100 to 110 providers on our list right now, all of whom will offer no cost treatment to either the gambler or their family members. And I think that's important to know too, because sometimes it's not just the gambler impacted by his activity, but it's anybody who's a close significant other to that gambler, and they may need support if the gambler's not ready for help. And part of it is the technical assistant is Kristen, who is our clinical manager, works very closely with providers on how to integrate screening and assessment for gambling into what you're already doing. We're not asking for a separate assessment. We want to give you some ideas or some tools you can just integrate in your initial intakes without developing a whole new intake tool. So that's part of her role. And if you want to develop a policy on gambling at any of the CILs, that's fine too. We can help with that. Training, like I said before, we do training to clinicians across the state, and we've done a lot of training with those clinicians to build the clinical competency in dealing with someone who may have an issue with gambling activity. A lot of the same risk factors or warning signs you may see may relate to mental health issues or substance abuse as well, but we want to help you just integrate in more about what gambling encounters. Peer recovery, you heard from Will, we have 5 peer recovery specialists. They have lived experience. They help people on their journey to recovery. Prevention, we aim it at the full age range spectrum across all ages, and for special diverse populations as well. Youth, elderly, those with substance abuse, mental health. Research, we work right now, there's the state behavioral health administration also has a contract with the university's epidemiology department, so we try and look at research that we could do. And one of the things that we've been doing here in Maryland is there was a prevalence study done in 2010, another one in 17, and another one to be released very shortly that was done in 2020. Public policy. We have someone from the university's law school for a percentage of her time. She helps us monitor legislation on problem gambling. And this was especially important this year because, as you may or may not know, I think you probably all do, sports betting has been legalized in the state of Maryland. Now, the rollout hasn't been determined yet, but we're currently trying to work with the Maryland Lottery and Gaming Control Agency to make sure there are consumer safeguards in place as it rolled out, because right now they can give up to 60 licenses online and 30 licenses in other brick and mortar like the casinos, the bingo halls, restaurants. So when it comes, it's probably going to come quickly, and we've seen from other states that it increases the number of people who become at risk. And then no cost. Like I said, there is a state public treatment fund for problem gamblers. Doesn't matter if their income or whether they have insurance, they can get no cost treatment from one of the providers on our list to deal with the gambling problem, and so can their family members. So important to let people know. And don't forget 1-800-GAMBLER, best way to reach us. So who's the problem gambler? This is going to be real quick. It can be anybody. It doesn't matter. It is something that we know that many people can gamble recreationally or socially, probably about 90 to 95%, but there is 2 to 5% who could develop a gambling problem or become at risk for gambling. That 2 to 5 actually includes people that have a diagnosis of a gambling disorder and or are considered to be a problem gambling. And some of the work we've done in prevalence studies has shown that. So problem gambling and gambling disorder in Maryland, this is what I've been talking about. That study that was done by Tracy, who's part of the university's epidemiology department in 2017. We did a follow-up prevalence study actually to the 2010 study, where 87% of Marylanders say they have gambled in their lifetime. 19.3% during that study said within the past year. Of those, 1.9% showed problem gambling, and about 1.2% had a prevalence for gambling disorder or what was called pathological gambling. And this is right on par with what happens on a national level, same kind of percentages. Middle-aged individuals were found during this study, 45 to 54, a greater likelihood to have at-risk behavior. And one thing was Asian Americans, African Americans, those special populations, Native Americans, more likely to meet the criteria for problem gambling. So indicators of the race, that last one that we did, can be related to cultural upbringing as well, because as you know, in many cultures, gambling, especially Asian American, is part of the activity that happens within that culture. Some of it also is related to proximity to gambling, and many times it's in lower income neighborhoods. Okay, so people with gambling and disabilities. Again, I'm going to remind you, research is tough to find on this area. Much more needs to be done. But people with lifelong disabilities, more vulnerable to gambling, especially what we call video lottery terminals or electronic gaming machines. And for those with lifelong disabilities, I think that more consideration is needed to ensure people are informed and protected from the harms associated with gambling. So there's a number of reasons that were found in this, in some of these studies, or in this study in particular, why gambling venues are appealing to people. Number one is accessibility. Many of them are some are located in neighborhoods, near shopping centers, near destinations for enjoyment. Many of the casinos have huge shopping and restaurants that are affiliated with them. There's a ton of things to do when you're in a casino. You can get lost in the excitement. It's a chance for many to escape their problems. You kind of get lost in the atmosphere. It's a place where many socialize. It's where they get out and they get to be around others. Last but not least, it's also fun and exciting until you lose. So I think that's important to note. A portion of those diagnosed with gambling disorder or identified as a problem gambler are likely persons with intellectual and developmental disabilities. So more research is needed. There's only a couple of studies out there on this, but it's really to understand what we need to learn more about is understanding how individuals with a disability interact with and understand gambling problems. So if there are any cognitive issues that are going on with an individual, they may not have a good understanding of how it all works, how these video lottery terminals work, what the odds are of winning. So I think that's important for us to be aware of. And then the last, individuals with gambling problems share similar characteristics to all kinds of disorders: antisocial, borderline, narcissistic personality. I could go on and on and on. Some have had poor early relationships, substance abuse, depression, anxiety disorders. So I think my point with this bullet really is that screening for problem gambling must include screening for mental health. So even our clinicians who screen for gambling should be screening if there's substance abuse or mental health issues going on. And it should be the same in the opposite, vice versa. When someone's in for mental health or substance abuse or whatever, integrate problem gambling into that assessment, because you would find that they are at a higher risk for a gambling addiction. Okay. Problem gambling and learning disabilities. This was a sample done. This actually was done in Sweden. So I told you not much is done in the US, but of problem gamblers in a clinical sample of adolescents 16 to 18, 17% had a primary diagnosis of learning disorder. 11% of that had a diagnosis of ADHD. So youth diagnosed with learning disabilities like ADHD are more likely in adulthood to become a problem gambler. And what I want you to remember with that is that cognitive processing is impaired, and the inability to necessarily concentrate or maintain attention can lead to some of these gambling issues. So in a study of gambling in youth with hearing loss, students with hearing loss had a higher prevalence of lifetime and present year gambling. It was 35% higher risk for lifetime and 25% higher risk for the current year, as opposed to those who didn't have a hearing problem. So there's some like sporadic studies out there that talk about these things. And then significantly more disordered gamblers cite having been diagnosed with a learning disability in this study by Hardin, Kupta, and Davinsky, with a learning disability, 22.3%, and then non-gamblers, it was 9.4%, and social, it was 7.4%. So the data that's early on and being collected does show that there is this link. So internet gambling and disabilities, I wanted to add, just because with sports betting coming to Maryland, up to 60 licenses are going to be given for it to be done on the internet. And you don't have to be in a brick and mortar building to participate in sports betting. You can be sitting on your couch with a mobile device and betting. So it's important for us to really gain a handle on what's going to happen when Maryland now is putting in the ability to gamble via the internet. And I foresee that that ability may also lead to other things like the lottery, eventually being able to do something with tickets or Mega Millions or whatever else online. So we'll see what happens in the next couple of years. There was a study of internet gamblers, 12% reported, and there was like 1,920 people in that, 12% reported being disabled, and of that 12%, 40% were identified as problem gamblers. And, among another study of adolescents, of which 92% were diagnosed with a learning disability, higher levels of internet addiction was correlated with problem gambling. So I think just overall, we're finding that with Maryland moving towards online gambling, we could see an increase in people's ability and accessibility to gamble, which could increase risk for the whole population of Maryland residents, not just those individuals with disabilities. Okay. And then this was interesting, and Kristen and I talked about it, but problem gambling among those receiving disability benefits. And we thought we should put this in. Those individuals who are unable to work due to their disability were found to be among the most vulnerable to developing a gambling problem. 11% were at risk, 6% as problem gamblers, as compared to those with full-time employment. There was 4.3 and 1.4 respectively. Also, those individuals who were receiving disability benefits, significantly higher rates of problem gambling than others, 26 versus 14%. Problem gamblers are significantly more likely than non-problem to be disabled or unemployed in a study that was done in 2002. And among those receiving disability, problem gambling was related to poor physical and or mental health functioning. And what I think is important, if you look at the studies I've been presenting, most of them are from the 2000s, not the 2010, 11, 12. Not a lot has been continued to be looking at this particular relationship. So again, more work needs to be done with that. Having said this, I am going to turn this over. Make sure if you have questions, put them in the chat box. Aviola will let us know at the end. We'll try and answer them between myself, Kristen, and Will. But we're there to help. And I'm going to hand this over to Kristen.
Thank you. So the risk factors for problem gambling have been well established. So risk factors are a combination of biological and environmental factors that create a vulnerability to problem gambling. So we're seeing more and more women that are calling the helpline. However, men continue to be more likely to develop problems gambling. And men are also associated with engaging in high-risk behaviors and tend to start gambling at an earlier age compared to women. So as Mary mentioned, access is a big risk factor. So living near or working at a gambling venue creates easy access. And then with the internet or sports betting coming around, access is going to be even greater. Having a big win also increases the possibility of gambling problems. Those with gambling will form thoughts of fantasy, that they win. When they go to place their bets, they feel that they will win, that there's no chance of losing. They have a firm belief that they will win against the odds. And also a risk factor is a family history of gambling or substance abuse. Also, adverse childhood experiences can make someone more prone to developing gambling problems. We also see similarities in those diagnosed with gambling disorder and those diagnosed with substance abuse and mental health disorders. Living in an area that is faced with an inequity of resources, areas of high stress that might be faced with more violence are common risk factors, as well as adult and childhood traumas. I've heard many stories recently about those who are seeking help for their gambling, that they've used it as a coping mechanism to deal with like a tragic loss of a significant other, the way you might expect someone to go towards drugs or alcohol to cope. So gambling and treatment, it's something that is not often addressed in treatment settings. So as Mary mentioned, that's part of my responsibility is to help encourage providers to start asking the question. Those with problems gambling are often discovered while they're receiving mental health or substance abuse treatment, and some may never discuss their gambling problems if they're not asked. There has been a lot of research, there's been research, the Pegasus 2017 study asked problem gamblers about what were some of their barriers to seeking help for treatment, and 53% of them said that they wanted to handle it by themselves. Many are ashamed that they have a problem and worry about the stigma that they may face from family and friends just for seeking help. And 21% are unsure where to get help, and another 24% are concerned about cost. So the center does work to limit these barriers by partnering with providers across the state to offer no-cost treatment to problem gamblers and their families. So those that are in treatment for gambling are also known to have co-occurring diagnoses, not only with substance abuse, but also with trauma, as mentioned before about the risk factors. So up to 35% of disordered gamblers also have a diagnosis of anxiety or attention deficit disorders. So most of us can't imagine how the bells and whistles of a casino could be calming. However, for those with serious mental illness, they can find a calm in the storm of lights and sounds. There is a sense of reprieve, and the emotional pain has an avenue for release. Gambling can be a distraction to intrusive thoughts and can create the impression of feeling focused or in control. The time spent at a gambling venue can develop a person's sense of purpose and start to create one's daily routine. Gambling may start to feel like a job and feel like they're doing something responsible with their time. Often very little money might be used to gamble. However, the time spent at gambling venues is something that should be monitored. For those with serious mental illness, gambling is not about the money. Rather, it's about feeling equal to and connecting with others. Gambling venues can assist in developing a feeling of belonging and acceptance, as the more often you're there, the more often you're likely to see a familiar face. This can create a false sense of attachment to others, believing that friendships have formed. And then gambling venues can generate a perception of safety, that the casino or gambling venue is a safe haven to alleviate feelings of loneliness and boredom. I'm going to give it back to Mary.
We moved through that really well, Kristen. So when does gambling behavior become a problem? Well, when you become overly preoccupied with gambling, that's all you think about. You think about those past experiences, and it could be of winning and or losing, but that's all you think about is that gambling activity. When is the next time I can get there? So I'm sitting at my desk at work, or I'm sitting at home in my living room, and all I'm thinking about is ways to get money and ways to gamble. You're secretive. We often say gamblers are the best liars. They can keep that secret for a long period of time about their his or her gambling behaviors, and often would get defensive when confronted. But when you start to notice, and you'll notice a couple of things that I'll be going over on the next slide. But when things just don't seem right, you got to ask the question. Someone's not coming home at night, but they're not really at the office, or they want to be away from their normal activities. Gambling could be an issue. Gamblers are also known for running to the mailbox before their spouse or their children because they're not paying the bills, and they may be the one who pays the bills in the household. So money and financial issues are going to become a problem. They have unaccounted mood changes. Okay, 1 minute, maybe they had a big win at the casino, not so okay the next minute, because when we talk about a big win, usually it's great. Somebody's won a lot, but then they think, oh, I'm lucky. I'm going to bet. I'm going to keep on going, and then find themselves not only losing what they've won, but also losing more. So becoming more anxious. There could be isolation and withdrawal from their friends and family. And we can move. Yeah. What I was just saying, try to win back those losses. You think you're ahead, then you're behind. And then what do? I don't have the money. That could lead to some other issues that come up of, as you'll see, as one of them, borrowing money from family or friends or an employer, or taking money, which could lead to criminal events occurring. Gambling to escape their problems. Oftentimes, if there's a substance abuse or mental health issue, sometimes even if they've got those under control, they switch over to problem gambling. Missing personal items such as phones, jewelry, anything else in the household all of a sudden goes missing. Where is it going? And why aren't you seeing any money for wherever it is going? Trying to unsuccessfully control, cut back, or stop gambling behavior. I know Will is a peer, and many of us who work with individuals who call the center hear that all the time. I tried to cut back. I can't. And what people don't understand is gambling is an addiction. It's not been recognized as an addiction all the way along. Actually, the first time was when the 2015 diagnostic manual came out, where it was actually moved from an impulse control disorder under addiction. So it's kind of like where drugs and alcohol were back in the 60s. We've got a long way to go for people to really understand this does impact the brain, that this is an addiction. People are restless and irritable when they're not gambling. And again, the borrowing money or taking money to feed their gambling habit. So why address it? Gambling behavior and substance use or mental health programs or any kind of program that's helping serving someone who has whatever the disability may need. Individuals with substance use and mental health disorders, they're definitely at a higher risk for becoming at risk or developing a gambling problem. Gambling, even at moderate levels, can have an adverse impact on other health and treatment outcomes that the individual is coping with. Gambling can become an addiction. We just talked about that. You're recovering from one addiction, you move into another addiction. And that's why asking the questions in that assessment if gambling is an issue is really important. It could be a relapse risk factor. And again, gambling and problem gambling can exacerbate already existing psychiatric symptoms or diagnoses.
Sorry.
That's okay. So how do we assist you? Well, actually, I'm going to start with how can the center assist individuals or consumers with disabilities? Number one, the helpline, best resource, dial 1-800-GAMBLER. They will answer that call. They will see where you're at. They will listen to your story. And then they can actually refer you. If you're ready for a treatment provider, they have a list of Maryland treatment providers that can help at no cost to you or a family member. They can connect you even through a warm transfer to our peer recovery support specialists, which the helpline is really good about doing. And our 5 peer recovery support specialists answer that phone all the time. And we request that they have to be answered within 24 hours, because sometimes when somebody is even warm transferred, they may be on a call with another person. So, but we always get back to someone. Most likely they'll get the peer recovery support specialist right away. It's one-on-one support. And they not only get to the peer recovery support specialist through the helpline, but providers who are doing the treatment often utilize our peer recovery support specialists to help support them during the treatment process. So they always have someone there who knows what they're going through to help them through that recovery process. If a consumer knows of a community outreach event, think we should be involved, have a table, get out there, do a presentation, we're more than happy to do that. It's at no cost. And we do currently and want to increase, presentations to community groups and recovery groups. And often it is done, definitely the recovery groups, by our peer recovery support specialists, and sometimes with, if staff are involved, so is Kristen as our clinical manager. And how can the center assist an organization? Again, technical assistance to implement that screening and assessment tools, existing protocols. We're happy to help you with a protocol if you want one for your organization. Also happy to share with you screening tools we think you might be able to integrate nicely into the assessments and intakes you're already doing. The peers, again, provide those presentations to any recovery groups or any support groups, and also the one-on-one to individuals from someone who's been there. So we share our peers, not too much, but we share our peers, because I have to tell you, since the center has incorporated peers into our programs and our activities, we have been able to help more people get the treatment that they need to help get them to recovery. And not everybody's ready to go directly to a treatment provider, but with the support of a peer, we have found a lot of success. And collaboration with prevention activities to include gambling awareness. Sometimes, and for whatever reason, treatment's important, but getting the word out through prevention and education is just as important, so people know what to look for so they don't end up being diagnosed with a gambling addiction or going from at risk to becoming a problem gambler. Center also does free training, and it has CEUs, and it can increase the capability of your staff to assist those clients that you do work with. and those in the community that you work with. Everybody needs, many people need CEUs, but the training is really good clinical training that really looks at that clinical competency when you're dealing with problem gambling. And as I said earlier, there are a lot of similarities on what you deal with mental health and substance abuse, but there are some things that are different with the gambler. And that's why it's important to participate in the training. And any organizational or community event, you think it would be good to have us have a table at and get material, or just get materials to you. We can get materials to you for your offices to post. We have a lot of things. I know a lot of people don't like to take those huge flyers and, you know, put them in their purse or pocket, but we have a lot of small business-sized cards which talk about the risks and the warning signs and where to go for help. So we're happy to get you those materials. And then problem gambling, gambling disorder resources to help. We have 4 websites, but we have a specific website for the help seeker. It is helpmygamblingproblem.org. There's also the ability to take a self-assessment on this website. So you want to let consumers, or if you're listening, go to the website, see what resources are out there, what clinical help is out there, how to reach our peers, the 1-800 number. Just everything is on that website, and as well for providers on our main website as well. Gamblers Anonymous, you can go see what those meeting times are here in the state of Maryland. The peers are well versed on in-person meetings, and they've been a little tentative with COVID, but there's online meetings, there's telephone meetings, so the peer can help anyone get access or know about those meetings. Same with Gam-Anon for the family member. The Gamblers Helpline, which we talked about, the 1-800 Gambler number, 24/7. Somebody there. There's also text and chat with 1-800 Gambler. So there is availability. If you're not comfortable with talking on the phone, you can text or chat. The Maryland Coalition of Families, I wanted to bring up. They're a peer support system for family members of the problem gambling. They do already did a lot of work and continue to do a lot of work with substance abuse and mental health that is happening in families across the state. But they, in the last 2 years, have joined in with providing support for families where gambling may be identified. So they've received a lot of training. If we have a gambler that we're dealing with and a family member is brought up as needing some support, we refer them right over to the peer support specialist with the Maryland Coalition of Families to get the help that they need as well, to get them linked to the treatment they may want to go to it for free to learn how to better cope with what's happening with the gambler. Abiola mentioned earlier, Maryland 211. I've had experience up in Connecticut with 211. We were information referral and crisis up there. I think here in Maryland, the Department of Health, Behavioral Health Administration has implemented with Maryland 211, the press 1. So if you call 211 and you press 1, you can get right to someone who can help you in a crisis. So a really great resource. Middle of the night, you need someone to talk to. They have also been trained for any crisis information. And then the no-cost treatment for Maryland residents. I just want to repeat that. It doesn't happen with other addictions. We are lucky with legislation to have a state problem gambling fund, a problem gambling treatment fund, which comes out of the state's problem gambling fund. The casinos for their video lottery terminals and tables, they pay a tax. That tax goes into what we call the state problem gambling fund. It goes to the Department of Public Health and then comes to us for some of the work we do, to research for some of the work, and some of it goes to this no-cost treatment. So we want people to know there is help out there. And if you're a gambler, you know, money is not always readily available. So we're pleased with that. And I think, no, you went the other way. I think we're at the end with our thank you for listening to us today. I wanted to leave like 5 to 10 minutes available for any questions. So I'll go back to Abiola. There's me, I don't know the answers, there's Kristen, she'll know the answers, or there's Will who deals with the clients, the individuals. So please, any questions?
Yes,
Abiola?
yes. I think Cheryl Grossman, she's got her hand up. Cheryl, you go ahead.
Great, thank you. This is Cheryl. Thank you all for all you do. I used to work on that 800-426 number, so thank you so much. I have a quick question. Has anyone done any research lately around the confluence of addiction to like online spaces as well as addiction to gambling? Like that confluence, is that making it worse?
Yeah, to be perfectly honest, I'll let Kristen answer as well. When I was researching to do this presentation, there was very little out there that would respond to what you're asking. More needs to be done. I would like to see the center have the ability to do more, even if it's within the state. But I also sit on the board of the National Council on Problem Gambling. So I'd like to see us look at avenues from that venue as well. Kristen, I'll give it to you as well.
Yeah, sure. I was just going to add, so gaming versus gambling is still kind of a debated topic, and probably needs more definition, because it's gaming like playing like Candy Crush and those types of games, or video games where you can purchase loot boxes. These are what we call like gateways to gambling, because you have the opportunity to purchase something where you may not know what it is, like those loot boxes. So that's how it's kind of compared to gambling, and there is more research that needs to be looked at. But I hope that answers your question.
Yeah, the World Health Organization is looking at gaming more closely than we are in the realm of the gambling world as a problem, gaming addiction. So there's a lot of work, and I think it's going to be recognized more to do more research on it and to look at it more in depth in the future.
Yeah, in the international, for the gambling certification, the international accounts, I'm going to pronounce the abbreviation wrong, but they do have a gaming certification that they're developing, so clinicians can become certified in gaming disorder.
Yep. Abiola, any other questions?
I don't have
I
any
have
other
a
questions.
question. Abiola, Pauletta Shepherd at the Freedom Center.
And Pauletta, please go ahead.
Yeah, I've learned that in Parkinson's disease, because of the medication that Parkinson's patients have to take, the dopamine antagonist types of medication that affects the brain, can sometimes lead to excessive behaviors such as gambling, shopping sprees, sexual activity, that sort of thing. Now, have you all done any research with that, or experienced medication side effects that can create the excessive gambling?
Yeah, we haven't done any research per se for us, for Maryland on that issue. I know there is research out there on that, and how it may impact the gambling behavior. Kristen, I don't know if you've seen anything in your clinical.
Yeah, there's been research, and the peers are even familiar about that Abilify is a medication that can increase impulsive behaviors, which include gambling.
Oh, wow.
Yeah.
I'm not seeing any more questions in the chat, but I'm looking to see if there's anybody else got their hand raised, or if anyone else has any other thoughts. I feel like there's just so much in there for that presentation, particularly for the SILs, because of course we serve persons with disabilities who can present with all kinds of different issues. But I guess one of the concerns is, because we are focused on the individual with disabilities speaking up for themselves, being able to help someone with what might be a problem gambling issue requires that person share that challenge with us. And that's just not something that I've ever encountered in the 4 years that I've worked with Independence Now. And I invite some of the other staffers from the other SILs to share if they've had any kinds of experiences with this, with consumers. You don't have to, please don't share anyone's name, but just if you have that experience where where you're trying to help someone because they actually have, in fact, admitted that this is one of the issues, one of their issues. Any sales? No one from any of these sales has had a consumer?
What's interesting, and this is Mary, but what's interesting, Ariola, is that gamblers often wait till it's rock bottom before they'll reach out for help, even to us, regardless of a disability or not, because they just keep going until they hit that rock bottom. And what you might think is rock bottom for yourself is not the same necessarily for the gambler. So it's really tough, because if they're not sharing it, you're right. We can't also help someone if they don't want the help. So someone may refer them. One of the things I didn't bring up either is there is something called the Voluntary Exclusion program that all the casinos and bingo halls that are licensed have, where an individual can sign themselves up voluntarily not to be allowed into that venue. And the same will be in place for sports betting. It is a voluntary program. It's run by the Maryland Lottery and Gaming Control Agency. You can sign up for 2 years or lifetime. The issue that comes with it is here in legislation in Maryland, if someone then enters a facility where they have voluntarily excluded for, they will get a criminal citation and go to court. So yeah, it's in legislation. Now, what we've done is work with the courts and the state's attorneys to say, we don't want anyone in jail because they violated and went back in because they have this addiction. What we would prefer judges and the state's attorneys to do is refer them back to us to get a screening and assessment for a gambling problem so that they get the help they need. I've never had a case, even when I worked for the Maryland Lottery and Gaming, where a judge would put anyone in jail, but it is something that, and they know it up front when they sign up. But sometimes if you've got that addiction or you really are becoming addicted to gambling, you don't think about it until you enter that gaming floor. But it is one tool that they have that they can do on their own to voluntarily exclude. And after 2 years, they can request to come off. So.
I was just gonna,
Go ahead.
Oh, I was just going to add a little bit about social determinants of health, right? That's something that is kind of going around and people are asking more about that. And so something like finances, we don't always ask people about their money and how they're spending it. We might ask them about like what kind of income they receive when we do like assessments and initial intakes and things, but we don't always ask how they're spending their money and do they have troubles paying their bills. And so that might be another avenue too, to ask about gambling. It's how are you spending your money? Where are you putting your time? Because when you ask somebody about gambling, they may not always associate, well, I go to the bingo hall or I do scratch offs or I, play spades every weekend with my family and we play for money, so they may not think of that as gambling. And so sometimes we have to do a little bit of a deeper dive too, to ask about maybe games that people play or how they socialize. So I just wanted to add that in addition to the voluntary exclusion program, which is a great tool for those that do have a problem. Will, our peer, likes to call it the anabuse for gamblers because you'll be arrested if you go in there. So, or likely to get a citation or something like that. Sorry.
So from a public policy perspective, the other question is, the sort of unasked question is whether or not, I think I read somewhere that you would not be able to claim or file for disability for a substance abuse disorder, but only for impairments that are maybe associated with the substance abuse. So for example, some kind of neurological disorder. So are there conversations right now happening about whether or not problem gambling is considered an addictive behavior and could be considered a disability. And if it's not, why would anyone, this is the sort of conversation, why would anyone, quote unquote, admit to that if they're coming to some center for independent living, persons with disabilities, why would they mention that? If not within the context of, hey, I'm only receiving this amount of money, I don't really have enough money to pay my bills. I'm putting this question to the other Sills. Do we ask questions about money? Is it appropriate to ask questions about financing if it's not been presented to you as a request for assistance with financial? And this is really for other still people who work at Sills. What do you think? Cheryl, go ahead.
This is Cheryl. I'm not in any way, shape, or form in a policy-making position, but if the person is limited in one or more major life activity, including decision-making with budgeting, I think that's how we talk about it. I mean, I wouldn't necessarily be asking directly unless they bring it up, but there's a lot that we can do with independent living that gets at what the actual limitations are and how we might be able to help with coping skills, which may not be the budgeting itself. It may be the behaviors around how we think about it, how we cope with the other things in our lives, right? Which could include, this pressure.
Mhm.
Thank you, Cheryl. Lori Fitzel, I think, had a question about whether or not there's any information about how many are successful in getting help for problem gambling.
Well, we're still tracking that. Right here in Maryland, treatment, our clinicians work with Optum, which is the insurance billing. We don't have a report for the past year that Optum has taken it over. We do know on our end that our peers have been successful in referring a number of people, well over 100, 200 people to treatment. They make it to their first appointment, many of them.
Mhm.
What happens after that, due to confidentiality, we don't have the answers. Unless the individual continues to work with a peer and says, or joins GA and says, I've been clean now for 2 years, but it's not being tracked in the sense that we would love to know what those numbers are for success. I was going to add, when you asked the previous question, we're still trying to get the Substance Abuse and Mental Health Services Administration to recognize gambling. They know gambling is an addiction, but they don't fund it in any way, shape, or form. There is no federal funding. So on the National Council on Problem Gambling, we're still working legislatively to say, my goodness, look at the expansion across this country. We need to look at this. And there needs to be funds to be able to help people.
Is there a way to open conversation? What would be the better way to open a conversation about with someone with disabilities and the possibility of either substance abuse and or problem gambling?
Go ahead, Kristen.
Oh, sorry, I stopped sharing. It distracted me. Could you ask me again?
I was just saying, and again, this is for anyone, what do you think is the best way to open up a conversation with a potential consumer about disabilities and or substance abuse and or problem gambling? Because if there's an addictive behavioral issue, I'm not sure if it's one, appropriate to ask, and two, even if it were appropriate to ask, I'm not sure I know how to ask.
Okay.
So I'm just wondering what everyone else's thoughts are on that.
Well, I mean, part of the things that we do is try to talk about it in a conversation, to not have a judgment about how people might be spending their time or money, and just to have a conversation. And is this something that might be negatively impacting your life? You know, that there's help out there if this is an issue where, hey, we have this screening tool, you know, we could see maybe where you lie on the range. There's also, like Mary mentioned, on the helpmygamblingproblem.org is a 20 question self-assessment. But to have it be part of the conversation, you know, when you're asking people how they spend their time, if it comes to how they spend their money, that might be, you know, that is a sensitive conversation for a lot of people to talk about their money. But maybe how they spend their time, how do they socialize?
I'll just add a little bit to that, just in general on conversation. If I'm noticing something about an individual that's out of character for their behavior, whatever, I usually just say, I'm noticing this. Do you want to share what's going on? You know, I'm here to listen. You know, tell me a little bit about what's going on, because this is what I'm seeing and this isn't what I usually see in relation to your behavior. And I gained some of that perspective from doing work with crisis and suicide, is tell me a little bit about what's happening right now. You know, what you're experiencing and why you're feeling the way you're feeling right now. Are you willing to share that with me? So really just that general, you don't go, I don't necessarily go right up to someone and say, you know, because they're telling me they're depressed or whatever. Oh, so you're thinking, you know, are you thinking about killing yourself right away? I wait to hear the story. Then I ask the direct question. You know, I'm not afraid to ask a direct question, but I give them an opportunity to share the story. And that's how I would do it. I would just open up the conversation by saying, this is what I'm noticing. I'm concerned. I care about you. You know, do you want to share with me what's going on? And that may be a way to get in.
Katie, are you still on? Maybe not. We lose Katie, or Mike.
Mike is still
If
here.
there are, oh, okay. I was just going to ask a couple of the other directors whether or not, and we've got Sandra Scott. Hi, Sandra. Is there any thought that at some point in time that the Sills or Maryland Sills would look at changing the intake forms to include an inviting question or about problem gambling or substance use? What do you think?
Well, I certainly think we could look at almost anything like that if it would help people self-identify. I don't know why not.
I don't know that I'm saying that we should. It's just a conversation to say, you know, is that if we did start to think about it and talk about it, you know, how would we even start to approach that?
You know, I think honestly that I've sort of said a few things over the years and I've tried to help staff understand that it's about, sometimes it's easy in a human services organization to get so focused on getting the job done, whatever it is, filling out that form, assisting with this or that thing, that sometimes we don't spend as much time as I think we should at really engaging the person. You guys down at Independence Now are sort of my heroes in that regard. I've looked at a lot of the relationships you build with people in the community, and I think those are so important that it's not as much about this housing form as it is about making a connection with a person, and making that connection solidly, and then the person may call you back for no other reason but a week or two later. The original model of SILs from back in the 60s, 70s, 80s, et cetera, and some SILs I've seen do it very well, is very much an interactive thing where people come in and they may sit and chat for, there may be a chat room as in a physical place where people can go to sit and chat with each other. and build those relationships. Disability is about connection with other people who've been where you're at and are going through what you're going through. And then in that conversation, as you get to know people, some of those other things come out when somebody says, yeah, and my husband, punched me again the other day, or I stayed up too late last night and drank too much. And, if you hear that more than once, you get a little concerned. So I think it's about helping us as we grow in our skills in learning how to build connection and become a counselor, more of a counselor than just dealing with the presenting thing that somebody comes up with when they come to see us.
I have a thought. I'm Brittany. I'm with ARI. I'm peer support, and personal experience with this. And Mike made a good point. Is definitely that that trust value between somebody. And I am in recovery for substance abuse, so I can kind of see some signs just because of my own personal experiences. So when they look like they're a little over medicated, their speech is slurred, things of that. They're very depressed. They talk about their medication. It's kind of that foot in the door. And especially, with finances as well, having a more of like, who deals with your finances. And then sometimes it's key words that they say that you can pick up on that you might be able to indulge a little bit without being too pushy, but definitely that person to person contact of, the first 2 or 3 times might be an introduction and just, sharing personal experiences and letting them talk. It might take you 45 minutes, but it's worth it because the engagement of, the eye contact and the body language of listening to them, by maybe the next time that you come to the facility might open up a little bit more. But definitely that contact and that personal experience, that's worked for me in my experience. And then I'm able to open up that door a little bit more. Not everybody is in recovery, not everybody else has those experiences, but, kind of especially with these webinars, and thank you so much for the information, because it definitely gives you another look of like, well, my daughter has to deal with my finances because, I get too many lottery tickets. I'm on that Powerball all the time. Those are like, oh, okay. Those are key words. And then, you just kind of indulge in that and then see where that takes you. And hopefully they will open up, but it is something that, I know I used to struggle with because I didn't want to admit anything because I felt guilt and shame and I didn't want to judge. But, as I went through and I talked to a couple of people that didn't feel like I was being judged and I could spill the guts and I can be, that interaction, it was a little bit more, inviting for me to open up. So that's just my personal experience.
Absolutely.
Thank you so much, Miss Wheelchair Maryland. Thank you, really. Anyone else have some thoughts, comments, or questions?
This is Sandra.
Sandra?
Hi, this is Sandra from Independence now. How did I get around to this topic? Because I never go with my father and his friends for fun. But I learned, just to kill time. How do you know when you are a gambler per se? How do you know? Because I could take it or leave it. That's my point. How do you know when to take it or leave it? Gambling.
Sandra, you were going in and out. Hey, Sandra, you're going in and out.
I said, how? Can you hear me now?
Yep. That's better.
Yeah. If you're moving, maybe sometimes it helps to stand still. But yeah, you were going in and out. Okay. All right. Sorry about that.
Okay, I'm sorry. How did you get to this subject, people with disabilities and gambling? How did you get that subject? Never mind.
I don't know if you're looking from our perspective. There was a request made, and to be perfectly honest with you, I didn't know a whole lot when I first started looking into this about the link between disabilities and gambling, but there is research out there, especially with learning disabilities such as ADHD and just other disabilities, people with physical disabilities who have to be at home. And we know with other individuals that are homebound that sometimes access to mobile devices and computers can lead you into this gambling activity. So I think it is something to be looked at. I spent in the 80s, the first 10 years, 12 years of my career was working with developmental disabilities in the field and physical disabilities. So, and I knew then, before I was even into problem gambling, that sometimes people would take individuals who were in a group home or in a supervised setting to a casino for a recreational activity, just like we see buses for elderly at senior centers going over to facilities because it's fun, it's exciting, and so how do you know if you can set a limit? I'm going to go and I'm going to enjoy myself, and here's the $50 I can afford to lose, and you can walk away after that. Or if you get a win, you can walk away. You probably can gamble more socially or recreationally, but some people cannot do that. They can't set that limit. Even when people come to us for help, they may not be ready to quit all the way. We may need to do some harm reduction with them. Okay, you're talking about, and Will could probably attest to this better, you're spending $100, a day on lottery tickets. Maybe you should not be spending that much daily on lottery tickets until they're ready to get into recovery.
Yeah, I would make an observation, and that is, many, many years ago, 20 years ago or so, I owned bars and restaurants where we had poker machines, and virtually all the money that we got from those poker machines was from people who couldn't afford it. It's not the social game. I had no problem with the guy who came in every week or two and he throws $50 in the machine and then he walks away.
Yeah.
But those weren't the people that were making me the money.
Nope.
The people that were making the money for me were people who were taking food out of their kids' mouths, things that they should be buying, they weren't buying. They either had a life problem or a family problem. And gambling wasn't helping that, and invariably they got in all kinds of trouble, and it was just a sad thing to watch. And it was most of my customers, I'm sad to say.
Yeah, well, it's the dream of that big win that I can get out of my current socioeconomic stat, out of this income level. I don't have it. I've tried everything else, but this is the dream. That's what if you watch the commercials, it's the dream. That big win, that's what people see. And not everyone sees, even though on the back of tickets it says your odds of winning are 1 in God knows how many. Who's looking at that when they're purchasing those tickets? I don't know many people who flip it over.
I used to tell my customers, I said, they would come to me and say, when's this machine going to hit? I'd say, you know what? I don't know when that particular machine's going to hit, but I know if you play long enough, I'm going to win.
Yeah.
And I was always very candid with them. I said, this game is not made for you. It's made for me. I'm the one who's making this money here.
Yeah.
I just wanted to add something that I say is, I use the first step to help people identify when is it a problem. When you're powerless over the activity and your life has become unmanageable. So that's a clear-cut sign as a way to identify this is a problem. Not only like the tolerance, withdrawal, lying, preoccupation, all the signs and symptoms. But for me, when clients ask that, when I've done presentations with Will and the other peers, use the first step when you're powerless and your life has become unmanageable. But Will, you wanted to add?
Oh yeah, I was just going to say, I can think of actually a few clients that I'm working with right now that are all three on disability that I've literally talked to in the last week or so. And their gambling just got a little out of control. They dug themselves a hole, and they used money they would normally use for the normal expenses, rent, car insurance, things of that nature. And they want to stop gambling. The problem is when they get their check, they don't know what else to do because
but what is this meeting about?
So I was just going to they want to stop. They just don't know what else to do because they're on that fixed income. So when they get their check, the only thing they can think to do is to try to go back and buy scratch off tickets. And, you know, I think all three of them are scratch off and lottery players, you know, but they go out and buy their scratch off tickets when they get their check, hoping, like Mary said, to get that big win, get themselves out of the hole, and then they can stop. You know, their hopes are to get that win, and then they'll be able to get caught up and stop. So it's sad, you know, 'cause they're on a fixed income and they love to work. They love to make extra money. They're just unable to right now, you know?
And I don't know if what Will just said might also be a sort of an answer to your question, Sandra.
Yes, it is.
I have a couple of consumers, and even though they've never used the term gambling, they've talked at length about they use terms like impulse control challenges, and the need to have gotten a repayee because of the problems with quote unquote impulse controls and the amounts of monies that they spend on, you know, various things. I didn't get the impression that the things that they were spending their money on was with drugs. So it's on something online. I didn't ask what that was, but I think, and Chioki, this hopefully speaks to your question too, that I don't think anyone is asserting, I hope no one got the impression that there was an assertion that certain disabilities make you more prone to certain things, but that there are in fact links between certain disabilities, all disabilities, and the possibility that you can also have an addictive behavior disorder, and that is manifested or expressed as problem gambling.
So
I'm not
this
an
talks
expert, but
about
maybe you guys can
gambling
speak to that.
here.
Yeah,
So-
okay, it's you came in late. This is all about problem gambling.
Well, I know some people that have that gamble and that have had gambling issues that I worked with. Unfortunately, one that when I was working at the Giant on Milford Mill, he sadly he kept getting tips when he would clock off for his gambling and lotto habit, and that did rub a wrong way with my bosses there at the time. And more than once he tried to take it out on me, and I had to report this. You know, he was an older man, you know, but it's sad that seeing with this gambling and stuff, because it's not a good thing.
No, Kioki, we're wrapping up the call. Okay, so we want to give our speakers a minute to wrap up.
Also, can you send me some of this stuff?
I will send you. I'll make sure you get it.
Okay, you guys have any other calls that I can get on?
I'll send you some information about that, but let's let our speakers wrap up.
This is Mary. I just want to thank you all for listening to us today. You have our emails. We'll be happy to respond, myself, Kristen, or Will. If anything happens in the community, you think our participation will be helpful, we're there. Just let us know, give us some advance notice. We can send you, Abiella, the slides. I can have Kristen just forward you the slides if that's something you would like us to do, that you can share.
That would be great.
With the
And
CIO.
for anyone who asked, that would be fantastic.
Yeah.
Let me just, before we close, let me just offer thank you to you, Ms. Drexler, Ms. Beal, Mr. Hinman. We really appreciated this discussion, and I know that it gave all of our listeners plenty of food for thought going forward. And I'd like to invite folks to offer any notes about upcoming events, and then give Mike a chance to close it out.
I do, Abioli, just really quickly, I do have to leave. I have a 3:30 call. So
Okay.
I thank you for the invite. And again, Kristen can probably hang in a few more minutes, and if there are any questions, but if you need us, we're there.
Thank you all very much. This has been a fascinating presentation. We really appreciate it. Next week, don't forget, it's all about the Paralympics, and we're going to have some interesting guests. So come on and check that one out with us. We'll have more programs. If you have an idea for a program that we should do, please be sure and send us information so that we can go out and find a guest to come and talk about your particular issue. This is Independence Amplified Maryland, all about disability. We meet every Monday at 2 o'clock. So welcome. And thank you all very much for being here. If you get a chance, when you fill out that form after the show, send us a few dollars if you can, and help us out so that we can continue to bring these programs to you. Thank you very much to all our guests, and thanks to all of you for attending. We'll see you next Monday.